Warm greetings to all of you and welcome to this web conference dedicated to the use of digital technologies in the fight against COVID-19. I'm Lambert Montevecchi, founder and CEO of Boost Consulting. We are an international change management consulting firm entirely dedicated to the healthcare sector. I would like to introduce to you our guest speaker from India, Dr. Monika Sonu. Not only is Dr. Sonu an experienced medical doctor, but she is also CEO of an e-health tech company called Health Innovation Toolbox, which offers a full range of digital solutions and products. Truly a perfect mix of competencies to address and answer the queries we may have concerning the situation in India. Dr. Sonu, perhaps we can start by asking you a very basic question. Can you give us a general overview of the current situation in India regarding the COVID-19 pandemic?
Thank you very much for the introduction, Lambert. I'm very happy to be talking to you today and presenting the COVID-19 scenario of India. This event is truly a great initiative by High Tech Connect. I will highlight two important aspects while answering this question. First, the pandemic and the government response, and second, the social and the economic impact. So as on 27th of April, as per the MOH data, there has been over 28,000 confirmed cases of coronavirus and 886 people have lost their lives. We have a recovery rate of approximately 22%. So I must say that as a country of 1.3 billion, India has been very careful in dealing with COVID-19 right from the beginning, and it has taken several proactive measures to tackle the pandemic. It's the result of these timely measures and interventions that has ensured that India stayed ahead of the curve as the crisis evolved in the country. In one of its earliest interventions, the government of India organized a meeting of Health Crisis Management Group in early January and constituted a group of ministers to plan, monitor and review the situation regularly and ensure that everything is well coordinated among the central and the state governments. Just a brief, India is a federal union comprising of 28 states and 8 union territories. And right from the start, these states and provinces were given very clear guidelines of surveillance and contact tracing, the protocols that needs to be followed while, laboratory sample collection, the packaging and the transport, clinical management protocols, prevention and control in healthcare facilities, the discharge guidelines for the passengers who were under quarantine, the people who were returning from abroad. So these measures are being reviewed time to time and lessons are being learned and well coordinated among different teams and central government and the state governments. So social and economic impact, if I talk about the biggest social and economic impact on the country was definitely the lockdown, and we are in the world's biggest lockdown right now. So on March 24th, our Honorable Prime Minister announced a total lockdown of 21 days until April 15, which was truly unprecedented. So in a day, India shut its $2.9 trillion economy and imposed the lockdown earlier than many nations. So when our case count was around 500, we had travel restrictions. So, the states proactively cut access to public places much earlier. So in a way, this COVID-19, our war against COVID-19 had opened multiple battlefronts by then, from since January for us. So we have increased uncertainty, we have halted economy, and a lot of crisis to the Indian companies. But again, these difficulties were dwarfed by the hardships which were faced by millions of migrant workers with little economic buffer or safety net at the point when this lockdown was announced. So these scenarios made some even question the lockdown as a strategy at the first place. So without doubt, the lockdown has been costly in terms of increasing uncertainty and distress in the societies, but the benefits are significant in terms of where we see India now. Clearly, people's lives were given much more importance than the economy, which was a very clear, with a very clear leadership of, the central government. The lockdown came timely, and any delay could have resulted in a spike in cases. And you can imagine what spike means in a country of 1.3 billion. So the breather was that throughout the lockdown, the government ensured that the continuity of essential services like the power supply, the water, energy, food products, banking, and delivery of essential goods were maintained. And hats off to the people who were in the front line while the country ran smoothly over this period, and it's still running smoothly in the lockdown too. I'll be talking about this also. And during the lockdown, the government accelerated. This was a time which was bought in by the government actually, to accelerate its effort for effective management strategies and future planning, like food relief packages and relief camps were set, shelters were set, and pop-up clinics were built. We ramped up our pharmaceutical drug production, ramped up the facilities to tackle the capacity issue, which is huge in this country, at the primary level of the healthcare. So what we did is, like, we converted our coaches of Indian Railways as isolation wards, and many such frugal initiatives had been taken within the country to tackle the problems here in India. So I hope this will give you a quick summary of the 34 days of post-pandemic lockdown in India. Yeah, so this is about it. Yeah.
Thank you, Dr. Sonu. Perhaps we could ask you a second question. How and what digital technologies have been deployed so far in India to fight and control the epidemic?
Thank you for this question, Dr. Lambert. Very interesting one, as this is the theme of our discussion today. So actually, right from the beginning of the pandemic, India always has scouted for solutions that were more relevant to the country. And one of the earliest measures that was taken was the public communication, which happened to be the biggest ways to prevent community spread of the infection in the country. So all the digital mediums were used to spread the awareness about the basic do's and don'ts of the COVID-19 management, and informations are being continuously reviewed and released as the situation is progressing every day. So daily updates are being provided, travel advisories and other COVID-19 related decisions were shared right from the beginning, to everyone in the country. And here I would like to give a special mention to an application which is developed by the Indian Ministry of Electronics and IT. And this application became the most downloadable application in the world to track COVID-19, called Arogya Setu app. And this has been downloaded for more than 50 million users within 13 days of its launch. So quite an achievement. The purpose of the app is to notify if the users, if they have crossed paths with someone who has been diagnosed positive, and tracking is done via Bluetooth and a location generated graph that charts the proximity with anyone who's infected. Okay, and Bluetooth and location sharing features are there in the application. There is a self-testing function, symptom checker, self-quarantine instructions, and these are available in 11 different languages and is on both Android as well as iOS platforms. So apart from this, the Department of Science and Technology has announced short-term project on mathematical modeling of COVID-19 spread, with the use of machine learning, forecasting and inferences would be derived from the pandemic data, and they will come up with a focused algorithm for infectious disease modeling, and quantitative social science approaches will be used. And this makes sense because in the absence of preventive and curable measures, mathematical models can come handy to assess the potential for sustained transmission, or if the infections are going to spread in new areas. Especially it becomes very relevant in the country like India, because we are vast and we are very densely populated. So some of the facilities in the cities are even mapping COVID-19 positive cases using GIS technology. They are tracking healthcare workers using GPS, and they are drawing up containment plans using heat mapping technologies and all. So even in some of the sensitive areas and hotspots, drones are being used to for the purpose of surveillance. So apart from this, the government's digital initiatives, some of the big private players in the healthcare are also using AI-based corona risk assessment scans for screening and initial assessment. And again, these are available in the form of applications. Hospitals are using integrated telemedicine applications, and many companies are developing it now for the hospitals, and e-consultation provisions are being provided to the patients. Hospital helpline numbers are coming with chatbot options, and COVID-19 risk assessment tools are being developed by many companies to do a preliminary evaluation and to lessen the burden on the healthcare facilities. And many startups are also contributing to this. So out of all these, that caught the attention of all of us Indian is how the Indian government is using phone connections and the role of mobile phones and smartphones to spread awareness about the coronavirus and COVID-19. The government is doing this by asking the telecom service providers to replace usual caller tunes with a coughing sound. And this is the corona virus caller tune, and it has definitely brought in a great sense of awareness among Indian people. And this has only been possible because of a huge amount of mobile penetration in India, either urban or rural. So yes, these are some of the striking digital initiatives which are taken in the country right now, and every day there are some or the other thing in the digital technologies which are coming up to tackle this crisis.
Thank you, Dr. Sonu. A third question. Have the measures and deployments been effective? And if so, how? And if not, why?
Thank you for this question, Dr. Lambert. Though India is reporting continuous new cases, but currently the corona case is doubling in about 7.5 days as against 3.4 days before the nationwide lockdown was imposed. So this clearly shows India is on the right track as of now. As per the reports, India has nearly flattened the curve and controlled the rampant transmission while increasing the recovery rate to almost 20%. So far, we have conducted over 500,000 tests, which is very low compared to other countries and accounts for almost 105 per million people, but we are ramping up. We are ramping up every day. The successful strategies and major actions taken so far, I would just give it in pointers. So the first one is the lockdown one, which was 21 days, and we use this to quickly increase our capacity to stop the spread of infection, to spread awareness among the people, and to better equip ourselves and train and deploy healthcare and public health workforce. We equipped laboratory facilities, and all in all, this time was used to treat and isolate the patients. So talking about the lockdown one, just once we completed it, we went into the lockdown 2. So as per the scientific advisory, lockdown 1 was not sufficient to control the spread of infection, and so we created the second window of the opportunity to contain the virus, and this window will help in tracing more potential cases whilst saving others from getting infected. According to Ministry of Health, if India had not implemented either containment or nationwide lockdown, the cases growth would have been by 41%, by now. And we would have reported almost 8.2 lakh COVID-19 cases by April 15, which could have clearly caused a complete chaos in the society by now. So this was about the lockdown 1 and the lockdown 2. The other things are like, from very beginning, we had put surveillance at the country's entry points, and we did community surveillance of all the passengers through integrated disease surveillance program network. We expanded and ramped up our laboratory testing. We ramped up the production and procurement of medical supplies. Rampantly, we did public campaigns and public communication through all the possible channels and mediums, and to spread the awareness and to involve people as much as possible. We ensured the safety of Indians who are in the country and also the safety of Indians who were abroad at that point of time. So what we did is we brought every one of them back to the country. We kept them in quarantine, and if they were infected, we treated them. So these were, in my view, some of the very successful strategies till date. And I would like to talk a little bit about lockdown 2 here. Because the virus is beginning to spread through the dense communities in India, and a new cluster of infections, are being reported every day around the country. So lifting the lockdown was not a good idea, and it could have easily, easily risk, it was like triggering a fresh wave of infection in the country. So a harsh lockdown is certainly needed to slow down the spread, and the manageable stage that India is currently in would be unimaginable and impossible without this timely, holistic, and integrated approach, by the governments, both at central and the state level. So the path of distancing and lockdown that India took, turned out to be the best course, and the benefits are there for all of us to see. So yes, the measures and the deployments have been very effective till date for India. All the measures which has been taken by the government, both the central government as well as the state governments. Yes.
Thank you, Dr. Sonu. Perhaps one last question. Are there any other lessons learned and takeaways you'd like to share with us?
Thank you for this question, Dr. Lambert. I would answer it this way. On March 17th, India's case count was 137, and by March 23rd, it was 471. So within a span of a week before the lockdown was imposed, we could see such a sharp increase in the number of cases. Okay. Hence, we all can imagine like how the rate of increase could have been exponential without a lockdown. And as a matter of fact, we are not the best equipped nation to tackle such a pandemic. And in fact, we have seen that even the best of the healthcare systems are struggling to keep up with the pandemic. So if I talk about our healthcare system, then it's definitely weak with respect to infrastructures. We have manpower issues, we have capacity issues. So I want to emphasize here that, we handle this pandemic in a very holistic way and in a very proactive manner. As a nation, we all focused on what we have and what we can do with the limited resources that we have rather than what we don't have. A very strong leadership of our Honorable Prime Minister, his timely decisions, transparency, his regular address to the country, it changed the outlook of entire nation, and people's trust were built on the system, that the hard decisions are for the welfare of the society and for the entire country. And for sure, we all showed a great amount of patience in lockdown 1, and as well as the ongoing lockdown 2. So the entire nation, they adhered to the lockdown, and all these steps helped India to navigate till the point where we are standing right now. So however, this is just the beginning for us, and India might see several rounds of suppress and lift cycles. And during these periods, restrictions might be applied and relaxed in a way that can keep the pandemic under control for sure, but definitely at an acceptable economic and social cost for sure. Okay, so the immediate challenge for India, I would say, is to ensure that rural India is not hit. And it is very clear that the shutdowns, need to continue unless transmission has slowed down considerably, and testing and health infrastructure has been scaled up to contain and manage the outbreak, or at least we come up with some kind of medication or vaccination for the virus. So at the end, I just want to add that yes, definitely there is a big takeaway for India here. The country needs to be prepared for what next and where it wants to position its healthcare as a sector. in terms of government spending and priority. We need to gear up in formulating a robust primary healthcare network across the country to deal with such situation today or in the coming future, for sure. Okay, so thank you so much, Dr. Lambert. It was great talking to you today, and I was honored to present my view on my country. Once again, I congratulate the entire team of High Tech Connect for coming up with such a novel concept and arranging such a global event. And very happy to participate. Have a good day to all of you, and thank you very much. Thank you.
Dr. Sonu, thank you very much for these precious contributions and insights. Hoping to see you in person on September 21st at the eHealth Application Summit in Winterthur.